Hello, welcome to the Newman Bond. My name is Dr. Yelando Johnson, and I'm with the Social Work Program here at Newman University. And I have with me...
Hi, I'm Vanessa Rials. I am the Director of Field Education and an instructor here at Newman in the Social Work Department. And we're here today to talk to you about
Social Work Month.
Yeah.
Which is a national celebration.
To honor social work and the work that we do. So we're just going to have a conversation. I do have a question for you.
Okay.
Why did you get into social work?
You know, this is a true story. So originally I went into nursing.
Oh.
I did. And I realized that I did not like chemistry and human anatomy. And so I went to the advisor at the school and I said, I really like helping people, but I just don't think nursing is for me. And she encouraged me to take a class called Introduction to Social Work.
Okay.
And I took that class and that was it. I was hooked from that point on.
Yeah.
Yeah.
I started out as an education major.
Really?
I was bouncing between education and psychology because like you, I knew I wanted to help. Like that's always been a thing. I was that friend that people would bring their issues to or the mediator in family conflict. And yeah, I quickly realized like, no, I don't want to teach. So what do I do? And I took an intro to social work class.
Really?
And I was like, okay, this is it.
Yeah.
Social work. Yeah.
That's why I'm so glad we have that intro to social work class so that people, you know, that really don't know much about social work. And actually back then, the only thing I knew about social work was that they go into your homes and they take away all your children.
Right. That's what the stereotypical idea of what social. And then I realized like how diverse we are.
Yes.
Like we both have social work degrees. You're a chair of a department. I'm a director at a university. Like we're everywhere, hospitals. I know Wichita's doing a really good job with incorporating us like in the police department now, like ComCare. I went out on a couple of mobile crisis units to assist officers and like schools, courtrooms, executive directors, like we're everywhere.
Yes, and actually, you know, I think that's one of the reasons why social work is celebrated. And when we think about advocacy, you know, so social work, the celebration of Social Work Month actually started about 60 years ago, really from the National Association of Social Workers.
Okay.
But then it just kind of died down. But then in 1984, our president at the time was Ronald Reagan. And the Democrats brought it to the forefront to say that social workers work so hard and they need to be recognized. So he actually signed a bill in 1984 recognizing March as Social Work Month.
Nice.
And so that's how it's been ever since then, you know.
Yeah.
And it's been different themes just to recognize. And I think it's important because so many people have contributed to social work. I mean, we have over 700,000 social workers nationwide. That needs to be celebrated, and social workers don't get the appreciation that they should get.
Yeah, definitely. So. I think they're starting to recognize it more. Like you're hearing, you know, mental health. You're hearing all these buzzwords, if you will, that social workers naturally fall into. Like we're behind crisis. We're behind the schools, the education, the trauma informed. Like that's what social workers are kind of leading, and now they're really pushing us to the forefront. So I appreciate that. Even in pay, like they've been increasing a lot of pay for social workers, clinicians too.
Yeah, because they're recognizing that their work is valuable. And I think that's the difference. And actually, so that the theme for this month is the NASW is saying that social workers need to get paid more. So that's what they're advocating for. That social workers are not paid for the work, the amount of work that they do.
Yeah.
Especially in areas of family and children's services.
I agree.
Yes, absolutely.
And you look at the toll like that this profession can take on you. Like we often meet people in one of the most vulnerable or worst times of their lives.
Right.
And like we're there to assist them through that, to give them resources and just to pick people up. And so that's a lot. for like all the social workers out there doing that crisis work or that children, that family preservation, all of that stuff. So I'm glad that it's starting to get recognized. I'm proud to be a social worker.
Yeah, I am too. And you know, when I first started in social work, of course, it was in 1992.
Okay.
So were you born then?
Yeah.
You were born then? Okay. Well, I mean, you know.
It's like one, but yeah.
You was born in 1991?
No.
Okay.
But I was a baby.
Okay. Yeah. And so in 91, I didn't even imagine how broad social work is, because I just, you know, I knew it was family services and just being a coordinator or a case manager.
Yeah.
But it has evolved in so many things. And even back then in the 90s, it was important to get your master's degree, you know. So even back then, and like it is now, getting
your master's degree just opens up the door.
It does, absolutely.
It definitely opens up the door. Like, I got my bachelor's in social work and my master's in social work, but the difference between the two degrees is like definitely go for your master's.
Absolutely.
And there's so many programs, like ours included. If your undergrad is in social work, you can go into that 1 year program to just push through.
And I think we're probably one of the few programs that actually have that, the social work.
Yeah.
If you have your undergrad, you know, it's just 1 year. It's a summer and the 2 semesters, and you actually, you know, graduate and you can go take your license.
Yeah.
Which, if you think about, you know, disciplines that have license, is what? Nursing.
Yeah.
Doctors,
psychology,
you know, psychology,
education.
Education, and then social workers. There's not many disciplines that require license, but social work is in one of those groups.
Right. And I think what I love about our program too is the different tracks.
Absolutely.
We can do. We talked about how diverse social work is. So with our tracks, we have the clinical track.
Yes.
And you know that opens. I mean, that's pretty self-explanatory. That clinical, the diagnosing, the therapy. Calm care, MHA, all of those, and then the administration track. So funny, when I was in school, I didn't want to be a caseworker. I didn't want to go into clinical work. I was like, I want to be a boss. Yeah. I want to be an executive director. Yes. I want to run for office or something. So I really utilized my MSW like that. That idea of use this to learn the people skills that are necessary to run an organization, to speak, to go and teach. So that's where the administration, I think, and then the School of Social Work is pretty popular too.
It is. In all of those tracks, you know, the leadership with the administration track, but all of those tracks, the school social work, you know, it still have that basic, the trauma. Yeah. Because you have trauma in all of those fields, which is great, you know. And so with our program, I think our program is very unique. We're one of the few programs that have this trauma-informed practice, because everywhere there's trauma. There's the, you know, in schools there's trauma, and the teachers do not feel competent enough, you know, dealing with trauma in the classroom or dealing with students with trauma, whereas social workers are trained in the specific areas. Even in the medical field, nurses and doctors are not trained, you know, to deal with patients with specific trauma, where social workers are. Yeah. And so if you think about any field, you know, social workers are needed. So I think that's what really makes our program stand out, is that specific curriculum, that foundation of getting that. And then, of course, we have instructors that are specialized, you know, that have been doing this all their lives. And so, but yeah, a lot of the mental health professionals, a lot of the mental health agencies, they need training in assessing and diagnosing, because things are constantly changing. Yeah. And so that is so important, you know. And I think the fact that we have those skills and we can provide that type of training is really important.
And they want it.
Yes.
Like it's, so I've recently got to do more trainings like in the medical field. Yes. And it's so receptive. Like it's so received by doctors, like all these, because you're right, it's like teaching them how to interact, how to recognize trauma, how to work with people with trauma, how to process your own trauma when working with
Right.
someone with trauma. Like we
Right.
do have that skill set. I think
Yeah.
that's, and then you get to come to practicum. You get to come hang
Yeah.
out with me and field. And I work really hard to find placements for students that, you know, it's their interest, that will help them learn a great environment. And we have paid practicums.
Yes.
I think that that's
Yes,
pretty
we
awesome.
do have a lot of paid practicums. Yeah. Talk
And
about
then
some of them.
The
'Cause
stipend.
I get so excited.
You talk about the stipend.
Okay.
The Bishop Gerber
Yeah.
stipend.
So we have the Bishop Gerber stipend, which is absolutely wonderful. We're so thankful to be partnering with them and offer this opportunity. If anyone is interested in working at a Catholic institution and integrating that social Catholic teaching and learning into their practicum, they receive this stipend, and it's very, very generous. It's very, very generous.
And it's per semester.
It's
which
per
is nice.
semester. I think it's like $3,000 per semester, and that does help. That does make a difference when you think about practicum, because you're going to be doing your practicum at least 16 to 20 hours per week. So that makes a difference, especially because we do have we have a lot of non-traditional students who have families. So we're really excited about that. And then we have the Health Corps Scholarship.
Right.
That's going to even grow even bigger. So we're really excited about that. In addition to actually having a Health Corps Scholarship, some of our practicums, in addition to scholarships, they also pay.
Right. Paid practicums were
Yes.
really important to me, and you hear them more often now because I was fortunate enough to have a paid practicum both of my years when I did my undergrad and went back to grad school. And it makes a big difference because, like she said, we're spending 16 to 20 hours a week at these agencies, and we still have life. We still have bills. I recognize that. And you're right, like a lot of our students come with families or just the basic needs of survival.
Right.
So working really hard to find those paid practicums is really important to me. Or job-placed, employment-based practicums. So how can we figure out if your current job can be your placement so you don't have to shift too much? And then, so just really, really working hard for those paid practicums is important.
Yeah, and I think over the past couple of years that we really have worked hard in working with individuals, you know, as far as these paid practicums or employed practicums, just to make sure that, you know, they can still receive their income. Yeah. And still come to school.
Definitely.
Because it does take time, you know, in grad school.
Yeah.
The other thing that we have changed is that we offer both. We offer both online curriculum and on ground.
Yeah.
And it's very flexible. You know, some students do both.
Yeah.
Pretty much.
Yep.
And so I guess that's one of the other things that make us so unique is that because we are a small personalized institution, we do provide that one-on-one, you know, when it comes to advising or, you know, career focus, you know. We don't just go in a classroom and just teach. You know, we start in the very beginning with, you know, what are you interested in? What field are you interested in? What track are you interested in? Yeah. And we constantly provide the information, you know, or the experience, because we want our students to really experience all the areas.
Yeah. Definitely. And I like the smaller classes. You get to know your students more personal, like you said. And I think the thing about social work is we each come with a really powerful story. Yes. In some sense, whether it's something personal we've experienced or something we've witnessed or just wanting to be part of something bigger than ourselves. And so I think that takes, and that should take, that personal approach with students. Like if they're coming to you with something so powerful inside, we want to nurture that. And we have the opportunity to do that because we're so small and just, we're social workers, so we care. Like it's embedded in us, in our profession. And then we do have some great leadership that allows us to get professional development. Yeah, definitely. You know? And that's so important. Of course, with our field, we have to, you know, be licensed, and to be licensed, we have to, you know, get CEUs. We're really excited about this summer. We're going to be starting a course. It's called the Professional Ethics and Licensing Prep Exam. We feel like when the students get ready to graduate, like in May, is when they start worrying about their licensing, taking the test, and panicking.
And we thought that if we provided a 3 credit hour course in the very beginning to catch these students to start talking about the license exams, to start talking about professional ethics in the front end, that it would really make a difference. So I'm really excited about that. In the process of creating this course, it will make such a difference.
Yeah.
And even perhaps one day offering this course to the community.
Yeah.
And I think that's going to make a difference. I wish I had the opportunity to have something like that, because you can have those prep exams and they pay, I don't know, $75 or $100, but having step-by-step process and understanding these exams, because a lot of people don't know that you're not taking your exam at the Behavior, Science Board of Kansas. It's a whole different website. And then they just changed, actually, the ASWB is now partnering with another test place.
Oh,
so it's going to
I
be
didn't know
something
that.
different. Yes,
Yeah.
it started January of this year.
Okay.
Yeah.
Yeah, that exam kind of like lingers over you your entire schooling. Like you're nervous about it. That's the ultimate goal, is to pass that exam to get your license. So I think it's really cool that we're now focusing on how do we get our students to pass that exam? How do we equip them with all the tools necessary to be successful in the exam, but of course in the field?
Yes.
Like we really break everything down, and I think that's what's unique about us too.
Yeah.
So.
Yeah. And I think the fact that we do a lot of collaboration, we have a lot of community partnerships, of course, with all the field agencies.
Oh yeah.
But we're starting to build a lot of interdiscipline within Newman,
Yeah.
community partnerships, I think with nursing,
Yeah.
and even with the sociology, psychology students, and we're starting to build a partnership with Friends, because a lot of students major in like psychology,
Or counseling.
Yeah, and counseling, and they realize that, of course, their senior year, they're kind of thinking, I can't do much with that, whereas if they would have majored in, social work, if the school doesn't offer it, but a lot of times schools don't offer the BSW, so then they're going to come back and get their master's.
Yeah, social work opens so many doors for you.
Yes.
Yeah.
Yeah, so, we're really excited about our program here at Newman. I got my MSW here at Newman back in 2005. So, I think it was well worth it. I did have a family, and at that time, it was 1 day a week.
Oh, yeah, that's how my program was.
Yes.
1 day, all day, from like 8 a.m. to 7 p.m.
Yes, absolutely. Yeah.
We were held captive.
Yeah.
It was
And
a long day.
you had like a toward the evening, you had like a 2-hour break.
Oh, we didn't have breaks.
Oh, you didn't have break? Oh.
No.
Yeah, we had like a 2-hour
I
break.
don't think we did, unless like a class was canceled or something. But you go through it with your cohort.
Yes.
And your cohort becomes your resources when you graduate, because everybody goes to different areas, but in the same area or same city. So, the classmates that I had, I'm calling now, or some of them are my field instructors. Like, they really do become your resource hub within the city. So I think that's pretty cool. It's like a little community within a community that you learn to work and navigate. But I think that if I were to tell someone who's interested in social work, I would say that if you're interested in making a difference, if you're interested in being part of something bigger than yourself, if you're interested in helping people in some of the most vulnerable and tragic times of their lives, like this is the profession for you. And there's so many layers or levels you can do that on. We have the administration, we have the front line, we have behind the scenes. There's so many ways that you can make a difference, and it fits what you're comfortable with. It fits your skill level. It fits your personality level. And I think that's what I love about it, is I want to make a difference. I want to be, and for me, I like speaking, I like to talk. I like to talk. I like to be out there. I like to talk to, so that fits me. But for someone who's like, well, I just like to behind the scenes or research or policy, you're still making a big difference.
Yes. You're still a change agent.
Absolutely.
And you're still looking, fighting against the injustices and fighting for equality. And I think that's important.
Yeah.
Why don't you talk about like tomorrow you're having a field fair. Why don't you talk about
so
that?
tomorrow we're going to have over 20 or 30 agencies come to Newman from 4:30 to 6. And it's just an open field fair. All the social work students are coming to learn about the different agencies that are in, some that are in Wichita. But it's an opportunity for them to talk to people about, where do they want to do their practicum? Which ones are paid? Which is therapy? What's, you just get to hear all the different agencies from ComCare, MHA, DECA to Therapeutic Alliance to many different groups that are doing awesome things. Juniper Arts Academy that are just changing our community and really helping, heal what's broken in so many different aspects. So you get to come out to the field fair and just learn about those agencies and hear what they're doing and see how you can be part of it. So I encourage, our social work students are required to go, right? But for those who just want to come and hear more about like what people are doing and how they can be a part of it, because there's volunteer opportunities, there's employment opportunities, so it'll be a great time. And that'll be in the Dugan Conference Center. So we'll start sharply at 4:30 and then 6 p.m. is when we'll end. And it's come and go, so you can come when you can and leave after you've made your rounds around the different booths and stuff.
I think that's good. I think it's good networking.
Yeah.
And even the seniors that are graduating, I think they should come. Because
Yeah,
I
they're
think
coming.
I think that's good networking. And we have, and actually we have some alumni, that are big on hiring, not only hiring, but giving our students practicums.
Yes.
And then hiring them also.
Yeah.
But, so we'll have, that's just big networking. I was talking to a student this morning, and, I said, even though you're graduating, you should come out because networking is so important. She said, because I already know where I'm going for next year, for the fall. I said, but I think you should come out. So she said, yeah, you're right.
Yeah, we have so many graduates of Newman that want to get back.
Yes.
Like, so I started my field visits this week, which is just where I go out to each agency and meet with the student and their field instructor and just see how things are going. And my field instructors were a Newman alum. And they're just talking about how they want to give back, and that's why they're here, is because their experience at Newman and our department was just so awesome that they want to give back. How can they give back? Which makes for even better field instructors, when they're like, oh, I was there. So it's kind of like a chain of events, like with some of our students. So it's pretty cool.
Yeah, we have some alumni doing really great things in the community, like Health Corps, Teresa, Love Lady, the CEO, and she's been there for about 15 years.
Yeah, she's pretty awesome.
Awesome.
Powerful story.
Health, yes. Wonderful. She went from being a student to a patient there, and now she is the CEO, and it has went from this to that. But she was, an alumni here, and then we have others who are in administration, and others who are at BS directors in higher ed.
Yeah.
So our social workers really get, but you have to have this passion for it. You have to have a passion for it and things that you love to do.
Yeah, that's a requirement. That should be on our syllabus. It's just passion.
Yeah.
Passion to make a difference. Yeah.
And I think, and just kind of supporting each other. That's why I was just so happy to celebrate Social Work Month. I really, really wanted to celebrate it.
Yeah.
Because sometimes we get so caught up, and so many things happen on campus that we really don't get the chance to support it. But I really want to make an effort. And so I was so excited for Proclamation. I mean, we had so many good supporters there just cheering us on, you know. And I got to meet the vice mayor, and she has a nonprofit going on with her son, and I think was real unique. And she was even talking about providing resources for us for our resource hub. That was started. So, but it was really exciting to see everyone there, and just to have that. And so now we have this proclamation that we have for the first time, declaring Social Work Month.
And I've had a few people on campus tell me Happy Social Work Month.
Yes,
so that's kind of cool.
Just to recognize social workers. And sometimes people forget that social workers, even in higher ed, that we've been out in the field.
Or are currently in the field.
Or still in the field, with these experiences, which makes instructor is really good because you're bringing your practice
Right.
into the classroom, and that's what students want to know about.
Yeah.
And so that really does make a difference. And then just highlighting our alums,
Yeah.
you know, because we have a lot of alums that are doing some great things. So
We're pretty awesome.
yeah, yeah. And when I was looking up something, well, you know, I was looking like Mary Church Terrell, Dorothy Heights, especially those two, because those two are my sorority sisters. You know, they did some wonderful things as far as social workers. So, you know, they were social workers. There's a lot of people of color, you know, men and women that did awesome things, you know, first ones to get their master's degrees, you know, fighting for injustices, and the first ones, and of course, we can't forget the mother of social work. The mother of social work,
The mother
Jane
of all
Addams.
mothers,
Yes,
yeah.
Jane Addams. You know, she's the one that first started social work in Chicago.
Yes, yeah.
Jane Addams and Mary Richmond. But just reading some history on some of those was really interesting in how things got started. So I was really impressed. So social work really has come, you know, has come a long way.
It has.
Yeah.
Yep.
Yeah.
I'm glad to be part of it.
I am too. Yeah, I'm glad to be here. And you know, if you really want to get a solid, a good foundation in your social work program, I want to encourage you to come talk to us.
Yeah. Job security.
Absolutely.
Because it's only growing. We look at all the changes that are coming to Wichita with the behavioral health center and then the state hospital that's coming.
Yes.
You know, it's only increasing.
Yes.
The jobs, the position, the pay, the need. We need more social workers. And not just in the field, but like in leadership, you know, in office.
Yes.
We need a social worker for president.
Yes, we do.
Yeah, you should run.
We do. Yeah, I might think about that.
I think we need a social worker for
in my
president.
next lifetime.
Yeah. But I think that that's good. I think social work is an awesome profession. People are out here doing a lot of work, and
it is.
But I love it. So
yeah, me too.
That's us.
Yeah.
Check us out.
Check us out.
Come talk to us. We like to talk.
We do.
Obviously.
We like to talk.
And I have snacks.
Yeah. She has a lot of snacks.
I'm a snacker.
She has a lot of snacks.
Yes,
yeah,
but I
she's
share.
A snacks.
I share.
Well, you have to ask
Yeah,
her.
you
She
do.
doesn't just
Yeah,
generously
I don't
share.
just give it up.
You have to ask her. She's not going to just share. So.
Yep. Happy Social Work Month.
Happy Social Work Month.
It's like, what? I have no idea.
I get a lot more blessings out of that.
Really fun experience.
Really the Newman experience.